Hi, this is Dr. Stone, and welcome to our video called Home Remedies for Knee Pain. So the first thing we want to consider is the injury a true injury, or is it a system pattern? So a true injury is a muscle or tendon strain or sprain from physical stress and overload. So it's going to be a typical injury like a NFL lineman falls on your knee, or repetitive. You work as a carpenter, you're hammering for 6 hours, so we actually have the excessive physical stress there. If there's no known injury, it can be a system pattern, so a shift in the defense system or communication system, that's your hormones, that's your immune system, that results in some neurologic change, which changes your muscle tone. So the one that we are most familiar with is the stress posture. So we get a forward head posture, and that puts a lot of stress and strain on the muscles back here and up in here, and we end up with neck and shoulder pain. These muscles may actually get injured as a result of the unusual load that they're carrying, and so you would still have to treat, just as we are going to in the next few slides, but you'd also have to consider the stress physiology and do some things to change that. We're actually going to talk about that system pattern a little bit. So home remedy number one is trigger points. Just a little history on that. These are areas of tenderness within the belly of the muscle that cause remote pain, so referred pain. So you'll see what I mean. Upon direct pressure, so you just hold the pressure. Mapping is credited to President Kennedy's White House doctor, Janet Travell. Locate the sensitive points, hold direct pressure until the pain fades, generally a couple of minutes. And just as a point of interest, maps coincide with acupressure points from Eastern philosophy. So you may be, when you're doing trigger point therapy, you may be doing some acupressure therapy also. So grab your knee and just walk along, and if you do find a tender spot and you want to hold it for a minute, just pause the recording, pause the video, and hold it, and then just get it started again. So you're going to treat your knee, check it and treat it as we go through this video. So so you can see in the calf muscle, so we're starting out with posterior knee. We have 4 different trigger points in the calf muscle. So you just kind of start, this is the medial side, and you poke in to the upper calf here, and you hold it. Well, look around and see if you find some tenderness. If there's no tenderness there, there's no trigger point there. And usually you'll feel some sort of a tissue change, maybe a little ball, or maybe it's gritty or something like that. And if you find the point and you hold it, you'll see these are the typical referral patterns that Dr. Travell mapped out over the course of her career and hundreds, thousands of patients. And then you move over a little bit and you just kind of slide across and just see if you can locate those tender spots. If you do, stop the video and hold it and see if it'll release that pain or have it come back to a smaller point. In the hamstring, you can see the potentially can be distributed all through the back of the thigh there. So you just kind of want to scan through the whole back of the thigh and see if you can find any tender points, and then you hold them for a minute or two and you can see the distribution. And then this muscle is called the popliteus, and it's basically right in the back, just a little bit lower than you were on the calf muscle. And the same thing, look for the tenderness, hold, note the referral patterns until there's some relief. Anterior and medial knee pain, you can see one right in here called, this is the vastus medialis, and here's your pain distribution. This one's up in that muscle a little bit more, so you can kind of scan around here a little bit. This is the rectus femoris, so you can see right below where that bone is. So if you feel the bone, that pokes out in your hip, and then you go down and then down a little bit more and down a little bit more, and just see if you locate that tender spot. And then up in the thigh here, this is the one that's going to be most specific to the knee. So just on the inside of the leg there, you're looking for a tender spot. And then lateral knee pain, this is the muscle is called the vastus lateralis here. And you can see the trigger point distributions. And there's your hip bone, so you can use that as a marker. So that you feel that hard bone and just go right under it. And then right in the belly of the muscle, or the meat of the muscle, you can look around in here. And then right at the base of the muscle here, where it kind of starts to attach into the knee. And you can see the distribution of the pain that she observed. So that's trigger points. The next is looking more at, so that was the belly of the muscle, the meat of the muscle. Now we're looking at the attachments. So where the tendon attaches into the bone, or we can also use transverse massage over the ligaments. So if we look at the hamstring muscle here, you can check right on the butt bone and below it. And if you notice tenderness there, and I usually describe it as exquisite, if there's some injury there, it's going to be exquisitely tender. I mean, you'll notice, you'll jump, it's not going to be questionable. And you rub across like this, the attachment. And the same thing down here, you get on this little bone that's the outside of the knee, and you check here, and you can check all the way up this attachment here, or this tendon, and see if there's any tenderness. And if there is, you just rub across that way on the side of the knee, and then the hamstring comes down on the inside of, and so if you again use the bony structures, if you feel your knee, you'll feel this little bump right here on the inside of the knee, and you'll know that it attaches right down and underneath that. So you just rub under that bone, and then on top of the bone, and then maybe just a little bit above the bone, and rub side to side where you find the tender spots. And then the calf muscle, we don't see the knee part as well here, but I also want to clue you in that the calf muscle attaches down into the heel. So if you check, even going all the way up to the ankle bones here, so you slide your fingers forward and then all around the heel bone and see if there's anything there. I usually find it kind of on the sides here, and inside, outside, about even. And then you'd rub side to side again, across the fibers. And the description, or the why for that is, as it was described to me, is if you spill a bunch of toothpicks and you rub across them, they'll start to line up again. And I don't know how true that is, but it works for me. The technique works, and it strengthens muscles and it decreases pain. So this is the popliteus muscle again. It turns your toe in, so you can see right on the back. So you go kind of below the knee, the back of the tibia here, and you just go right down the bone, and you see if there's any exquisite tender spots. And then you'd rub up and down. You can see the fibers are coming in at this angle. So you'd rub up and down this direction, and then on the outside of the knee, you would come across this way. So you're just palpating again. Here's your bony structure. You can see that the muscle kind of wraps around and attaches under and in front of that bone. So you got to be a little bit of an investigator and dig around in there. And then the thigh muscles, quads. So some of these muscles come right up onto, so if you touch the side of your hip, that bone that juts out there, You can see that they come in and attach on the front, and then right down even into the femur bone, the thigh bone itself. So you come off the hip and down the thigh bone, and again just looking, and if you notice any tender spots, again exquisitely tender, you massage across, and you can see some of them attach. This is that little point you see up closer. Rub across them here, and same thing here, massaging across. So if you find these, just spend 30 seconds massaging them before we move on, and then you can reassess your knee after the video and see if you had any effect. Usually what I'll do in the office is I'll have somebody, say it hurts to climb a stair, so I have them do a lunge, rate the pain, do the treatment, and then do the lunge again, and usually there's going to be a significant decrease in the pain if we did effectively improve the muscle function. Here we go right into the pubic bone, so you can get at this. You can feel the pubic bone in the front, and you can see that's on the underside, so you have to dig in a little bit and again right under that bone, see if there's any tender spots, massaging across this way, and then coming down here into the side of the knee, or that's the inside of the knee. This is the TFL, which ITB syndrome is associated with the T tensor fascial lata muscle. So you can see now you're on the side, you go right up under that ridge, you'll be able to feel the ridge, and you go underneath that first 1/4, and you see if there's any tenderness in there, and you massage across for 30 seconds. And you can see the muscle turns into the tendon here. You could check right at this area, which this is going to be your hip bone right there, so a little bit below that. And then it comes down and attaches here, so you just check and rub across that. Home remedy number 3 is acu-tapping, and really I would do it in this order. I would check for the injuries first, so that you're treating those, and then you can tap. This is a pain relieving technique. So you touch the area of the pain, and you could move the area of the pain. So like if it hurts to flex, you flex the knee a little bit, activate the pain, and then you tap. So if the pain is in the front of the knee, you tap on the yellow point, which is right below your eye. You hold it and tap 100 times, and do the same thing. You get up, you perform your lunge or whatever to see how the pain, if it decreased. Or on the side of the knee, outside of the knee, you could be on right beside the eye, or you might get some benefit from the one under the eye again. If you have posterior knee pain, you could benefit from this one in the corner of the eyeball, or possibly you could get a little bit off the green point here on the side of the eyes too. So I would just touch the back of the knee. I would tap number 4 100 times. I would tap the purple one inside the eye 100 times and reassess. And I know it sounds a little odd, but this is probably one of the techniques that I use most often at home, with my kids getting injured acutely, and treating that on the go, and in the office for chronic pain relief as well. So we're a tapping clinic, and we're a tapping family at home also. We do a lot of this and have had some remarkable results from it. So give it a try. Can't hurt, right? Tapping your face and holding your knee cannot hurt you. So here's one of the systemic factors that we should consider, and this wouldn't be immediate relief, but the adrenal glands are associated to the knees by the neuromuscular associations. So the gracilis sartorius and the gastroc calf muscle inhibition patterns are associated with adrenal gland function when you look at it in terms of Chinese medicine, how the connections happen there. So if there's hyperadrenal, if our adrenals are producing too much hormone, we want calming plants. So you can grab some skullcap wild oat seed, maybe some regulating plants. These, the adrenals are your day and night cycles. So up and down, sleep and wake. So regulating is helping your body go into those cycles more effectively. So ashwagandha, rhodiola, and you can mix these together and do. If you get it in tincture form, an adult dose is 1 dropper full. So you squeeze the bulb, and that's approximately 20 drops, and that's an adult dose in most cases. And you could do that 2 times a day, 3 times a day, and over the course of a couple weeks, maybe 4 weeks, reassess. That's not going to be a quick fix. The other things that we did that were physical, if they are true injuries, and depending upon how much is true injury and how much is systemic pattern, you could conceivably do the first 3 self-help techniques and completely resolve your pain. Because that's what I do in the office, and I've completely resolved pain. If the adrenals are fatigued, so we're producing low hormone levels, then we want rebuilding plants. The ginsengs, there's different types of ginseng, reishi, which is actually a mushroom, and astragalus. And then I usually couple that with something that's a little bit stimulating, licorice root, or whole adrenal glandulars are kind of stimulating to the adrenal glands also. So if you want to be vegetarian, do the licorice root. If you don't care, do the adrenal glandular. And just see. And how do you know if you're adrenal hyper? Typically, you can't fall asleep. That's one classic sign of too much. And then adrenal fatigue, typically you wake up at night. So if you have any insomnia symptoms, that will help you kind of identify. Waylabs, or WeLabs, I'm not even sure how you pronounce it, has some injury patches. They are herbal infused patches, so you're getting some herbal healing plants in the patch. You just place them directly over pain or injury. You keep them on 48 hours. You may have to tape them on with some athletic tape, and they recommend 6 patches for chronic injuries, which would be something that has stuck around for over 6 weeks. They say that the first patch should shift the injury back into an acute phase, so there may be a little bit of an amplification of some pain in that first patch, and that would be a normal, ideal response. It tells you that the patch is working. So these patches, I believe you have to buy them through a physician's office, and you can certainly get them from our office. Just give us a call. So so that's your 5 techniques, tips that you can use on your own. And then I wanted to just share a little bit about systemic management. If there is a pattern going on, how we look at that. So the first thing we look at is genes. If you have genetic weaknesses, and I can guarantee, well, I can't guarantee anything, but there's a high probability that you do. There's very few people that don't have genetic weaknesses. And you can just look at your family history. Is there some disease that shows up over and over? There are things that we can do to help express your best genetic potential. And then we look at the defense system. So that's your immune system. The analogy I use is, if you have a burglar come into your house and hold you at gunpoint, dinner is not so important. So this is your thrive making energy, and money is the currency of the world. Energy is the currency of our cells. So defense issues are going to be any invasion. So bacteria, chemicals. We have so many chemicals in our environment, yeast, things like that. Stress physiology, so that's just a change in your hormones associated with the adrenal glands. So adrenaline, cortisol, noradrenaline, those chemicals. So if you flood your basement, it's not as bad as having a burglar, but still you put off that hamburger. So we kind of have to soothe these layers before we can get to the energy making. And then if there's no energy, you don't reproduce. I won't go into detail on that, but this is how our cells work also, is the point here. So if we want cellular health, which means full body health, we have to go through these steps. So if you have an immune challenge going on in your body and you want to regulate your cycle, and you take something to regulate your cycle, it may seem like it's not working very well because you're not attending to the priority. And then I'm talking mostly in terms of like natural protocols. So like if you take Vitex, which helps your body to produce progesterone, and it doesn't seem to affect your PMS at all, you should just, consider well, how's my energy? We'll look at stress symptoms briefly, and then, what's going on in my defense system, or consider genetic. And we do have tests for all of these levels, if we do get into a diagnostic. I want to figure this out. It's just gone on too long. We have diagnostic processes for each of these steps, but this is how we look at systemic management. So here's how you would know if you need systemic management. We look at the symptoms. So if you have knee pain and your memory is horrible and you can't focus, you can't pay attention, you get distracted all the time, we know that our nerve cells are not working very well. Immune symptoms, that's going to be allergy, recurrent infections, or things like hives, your skin breaks out. The adrenal symptoms have to do with the sleep cycles, as I already mentioned. Energy plays into that a lot. If you're sensitive to sun, you walk out on a sunny day and you're squinting and you have to put on sunglasses, that's a sign of adrenal needs. Muscle twitching, you're laying in your bed at night and your muscles are twitching. Or if you get up off the couch and you feel dizzier, or you get that little blackout moment, those are classic signs or symptoms of adrenal problems. Thyroid, that's where we see a lot of just general tiredness, weight gain, low motivation, just can't get going. We see the hair and the skin, even fall out or just get really bad. And then your body, your core temperature is cold. So if you have knee pain and your core temperature is cold, you're gaining weight like crazy, you may have a systemic pattern where you need to address the thyroid needs before healing is going to take place. Because like I said, cell reproduction is really healing. Blood sugar, irritable, lightheaded, shaky before meals, that's hypoglycemia, or sleepy after lunch or dinner, coupled with I'm gaining belly fat, that's high insulin. Hormone problems, PMS, abnormal cycle, for men, poor stamina, low libido for either, and for men, erectile dysfunction indicates some change in hormones. So those are those are reproductive hormones, but they do affect cell reproduction also. So if you have knee pain and PMS, you may have to address what that PMS cause is before things completely heal. Digestion and elimination, what you might think: gas, bloating, heartburn, indigestion, constipation, diarrhea. Cardiovascular, cold hands, feet, as opposed to the cold body, the cold hands and feet. High blood pressure, heart palpitations, or you're laying in bed and you hear your heartbeat pounding. So looking at your body system-wise, you can kind of see like, oh yeah, I have tons of allergy symptoms, don't sleep all that well. You may need to attend to these system patterns to get optimal healing. We have a test called the multicam that in one fell swoop we get to see all of these systems by the numbers. So it gives us 7 types of thyroid dysfunction, immune stressors, inflammation levels, how your adrenals are doing, organ elimination, the toxicity, blood sugar, energy. ATP is our energy production, oxygen delivery. That's another important nutrient. If we don't deliver our oxygen, we can't heal. And then digestive function, inflammation in the intestines, organ health, and also electrolyte balance. So we see all the things that I talked about symptom-wise, all the systems that you have in your body. We get some representation of how those things are going, and then we can, with one test, we can say you have A, B, C, and D that needs to happen before full healing is going to happen. Now you have some self-help tools and a bit of information about our diagnostic process. You also know if you have a systemic pattern, if you have organ system symptoms, and that your pain relief and healing will be compromised. That means inferior results until you correct the system patterns. I've done a fair bit of reading on success habits, and one huge habit is taking action. I want to give you a good reason to take action, only if you need to, of course, and I'm sure you know if you need to take some new action, and maybe this is it. Check your gut, check your heart, because that's where the best decisions are made. If getting a thorough evaluation feels right, which would mean ending the guessing game, let's see, I'll try this next. We're going to reward your taking action by offering a nice savings on our diagnostic workup. Baseline, you have to have the full system blood assessment, or what do? We have nothing to go on. You'll find it is the most complete blood test you've ever done. It will give you a clear list of stressors and imbalances that are blocking you from health and healing. It would certainly be enough to proceed intelligently with correcting those stressors and imbalances. As you can see, normally our exam and baseline labs are $250, and we're offering that inquiry for a ridiculous $119. Essentially, that just covers my cost of the lab, and I'm willing to do that because I know you'll be amazed with the amount of information you'll receive in return. North Carolina law says that I have to inform you that if you decide to purchase additional treatment, you have the legal right to change your mind within 3 days and receive a refund. Now, option B includes a full immune discovery, where baseline testing says you have a bacteria in your small intestine or a food sensitivity. This testing allows us to identify clearly what food, what bacteria or yeast is present, creating inflammation and lowering your health, energy, metabolism, and healing potential. The food testing is the most accurate and detailed that I have found. It's called the ALCAT test and measures for 4 different types of reactions, whereas traditional testing looks at 1, IgE reactions, the acute response. Types 2, 3, and 4 are sneaky. They are delayed hypersensitivity, meaning that you eat corn today and you pay the price over the next week. And if you eat corn or whatever reacts weekly, you never stop paying. The infection testing looks at all pathogenic and opportunistic infections. Pathogen means acute symptom. Opportunistic means more subtle, but inflammation producing nonetheless. It's the subtle infections that tear down your health and healing over time. With those tests, it is normally $753, and our take action incentive is $569, a nearly $200 savings. With option C, we add the adrenal stress index, which measures how stress is impacting you and your adrenal glands. We all love stress, but when it alters our hormone balance, not only do we not sleep well or struggle with hypoglycemia, it affects every system, energy, metabolism, repair, and ultimately, it activates our worst genetic effects. Have you heard of this? It's called phenotype. And from our hardwired genetic code, researchers are now saying that everyone has a choice. If you get into stress overwhelm, you get your worst expression, and if you manage stress effectively, you get the best possibility. And plant medicines can influence these hormones without your changing your life, when we know what hormone shifts have happened. With that addition, it's normally $973, but the take action incentive is $719, over $250 savings. I know that you know, if you've been struggling too long, if you are tired of trying one thing after another, and if so, take action. Diagnostic testing is nothing but asking for information. Information that we can use to create a plan to get you to healing, energy, improved metabolism. I hope to see you soon. It's what I love to do, helping people solve problems and get right again so you can spend your energy on what is important to you. Wishing you amazing health, this is Dr. Stone. Goodbye.